So thank everybody for joining us this morning. Welcome to the Golden Key System Change webinar, Creating the Conditions for Change. Just a little housekeeping before we begin. Feel free, as I said, to introduce yourselves in the chat box. Remember to select all participants, or everyone, rather than panelists and hosts, so that everyone can see what you're saying. If you want to ask any questions at any point, rather than using the chat box, use the Q&A box, which you should be able to find at the bottom of your screens. We'll relay the questions to the panelists when they finish speaking at the end. There will be no slides during this webinar, but the session is being recorded and will be shared with all the participants afterwards. So you can feel free to share the recordings with all your colleagues too. A quick introduction to Golden Key. We're a partnership between statutory services, commissioners, the voluntary section, and people with lived experience across Bristol. We work together to improve services for Bristol citizens with the most complex needs. Golden Key has been funded by the National Lottery Community Fund for the past 8 years, and as the project is coming to a close in June of this year, we're keen to share our learning with the wider system. This webinar is the third in our series about system change. The first was on May the 5th and looked at the main systemic challenges we've identified when working with people with multiple disadvantage. Last week, we looked at how we navigated this complexity. Today, we'll be looking at system change in action from those who've done it. Our panelists will share what the conditions were that enabled them to create change. We were going to hear from Tom Dunn, but he doesn't seem to have been able to join us this morning, unfortunately. He was the lead for the service coordinator team at Golden Key, but we have got Lisa Murphy and Temba Mahari, who work in the specialist community forensic team at Second Step. And they're both Golden Key System Change champions. And lastly, we'll hear from Dom Wood, who's the CEO of 1625 Independent People and has been a loyal member of the Golden Key Partnership Board. So we'll get started. As Tom isn't here to introduce, I will introduce the first part. So this webinar, it's not about Golden Key, it's about empowering and enabling others to create change. And system change isn't linear. Golden Key has done work to empower others, and we have products that can help. But I'd like to ask Lisa and Temba to join in now and explain what enabled you to create change, the conditions, how did you put in place your team to enable it, and how has it worked for you? So I hand over to Lisa and Temba.
Morning, thanks for that. I'm Lisa, and as you heard, I'm a system change champion along with Temba, and we started together in a pilot project called SCFT, brand new project. So we had lots of enthusiasm, and really wanted to see how we could make a change. And in doing that, we had to think about how the conditions could be right for making change. So one of the very first things I did was set up a framework, set up some training, introduced the idea of system change, and just really got some ideas together. And Temba came up with one that we started as an experiment. Do you want to talk about that, Temba?
Yeah. Good morning, everybody. Yes, I'm with Lisa as well in a specialist community forensic team. And I think with regards to the conditions, I think what was really important was around understanding system change and trying to not get into too much of the sort of the functions of it, rather than just trying to simplify it. I think one thing that really helped a lot was having the support from the team of understanding what system change actually is, and that we all do it, because there is a lot of theory. But I think what's important is that recognizing that we all actually do it. And I think what was really important as well was around the relationships we build within the team. I think that's really important for any sort of change. It's important that relationships are built within the team and people understand where everyone's coming from. So myself and Lisa, obviously, we worked a lot together around, sort of championing system change. And one thing that really worked out was around addressing certain barriers. So my role is really around equality, diversity, and inclusion. And what having the condition of, as I said, relationships allowed us to have those uncomfortable conversations and address the issues that a lot of our clients faced. So I think that's really important around having those relationships. I don't want to keep talking. I don't know if Lisa, you want to sort of...
Oh, I agree. I think the relationships and exploring ideas was really fundamental. Like you say, as the EDI officer, you had a tough challenge, and it was thinking about that and how could things be done differently. Which we had some really interesting conversations. And certainly remember, we spent a lot of time bouncing ideas and exploring how far those ideas would go, and trying to involve as many people as possible, didn't we?
Yeah. And I think that's important of it, isn't it? Around the conditions again, it's about creating the space to enable each other and support each other. Because at the end of the day, I think, especially within our team, Lisa, I'm sure people could say that, I think we all are aware that there are a lot of mental health inequalities, and it's around how do we support and enable each other to be always aware of those issues. So what we introduced was the personalized equality impact assessments. And so rather than just focusing on the needs of our clients, we looked into the cultural needs. And I think having that space to reflect and to challenge each other and to ask each other questions, I think really allowed this action experiment to actually work really well. And yeah.
And I think as well, Timber, I think at the beginning as well, it's really identifying what that block was. I think that was, we talked a lot, didn't we, about all the different factors into that block, but it was drilling it down. It was like almost layers of an onion. And really getting to the hub of what you perceived. And I think it was keeping the idea of the client was at the center of everything.
Definitely. And I guess that takes a lot of level of sort of humility as well, isn't it, as professionals, and even approaching system change. As I said, there's a lot of theory, but the reality is we all do it. And I think having a culture of humility in terms of understanding and learning, and the attitude to always keep learning, I think helps things actually progress. And not being afraid to fail and getting things wrong, because some ideas worked, some ideas didn't, which was fine, but that is part of the process. So I think as long as there's a condition around learning, trusting relationships, reflective spaces, I think that really helps a lot.
Absolutely, and I think we really enjoyed the whole process. I think once we got into the swing of things, just knowing that this is something that we're all passionate about, and having that team support really did make a difference. And some of the earlier versions and the testing that went on, that took place, like you say, the learning, each experiment that we did, it didn't, even if it didn't result in a change, it resulted in learning. And I think that's really important, to not worry so much about there being a change at the end of it being a system change, but the learning, the process that you go through as you go through an action experiment, particularly around curiosity. Often we don't give ourselves enough time to be curious. We all have pressures, but having that space to be curious and asking questions, it's like a child really, but why?
And that's so important. And for me, one of the the biggest things that I took from you know, going through this process is around having those reflective spaces, like pausing, because we're in a, sometimes I think I speak for myself, sometimes just want to keep getting on with things and just do. But those times, Lisa, when we meet up, myself and you and someone else, one of our other second step colleagues, having those times in those meetings, and I have to give credit to yourself because you set up those meetings where we literally just reflected on the work that we were doing. And I think that's really, really important because it allows you to actually just come out of your own thinking and to look at it from a different perspective and actually see, okay, maybe I missed this. Well, we've created, you know, these this new system of change. Have we included, you know, our clients? Are they also co-producing with us? Are we working in collaboration with them? And I think that was really important part of it all, having that support and having that reflective space as well.
Yeah, I think so. I think peer support's really important when you're taking on an experiment. It's like you say, we all have our blind spots. So it's really good to have that questioning and other people having the question and the curiosity to ask, why are you doing it like that? It's really invaluable. I think one of the other things as well that was really helpful was being able to keep, and I always go on about this, keep data as you go, keeping records. Doesn't need to be a lot. It's just, even if it's bullet points. So it helps when you know you've looked at something, and sometimes an experiment they go in fits and starts, I find as well. Sometimes you might forget what you've done, but at least if you've got your bullet points. Yeah, we did try that time. Why didn't it work? What were the conditions then? And what are the conditions now? And be able to, you know, is this going to work now? We try it again, dust it off.
And I think also being quite creative. So a platform that you introduced, again, give you credit where it's due, Trello board. So using online platforms to visually see the work that we're doing and to try and, okay, right, so this is what we started off with. This is maybe not a priority at this point. This is where maybe we have a bit of a block. Okay, let's try something different. And I think for me personally, it really helped so much having something visual and to see the progress. And I think what you said there was quite key, because I think it's easy to do stuff, but when you actually write stuff down, it actually sinks in. And again, this is probably connected back to the reflection. It allows you to see, actually, maybe I missed out something here. And I think that really helped, having those visuals and watching the process and watching and celebrating the wins, even if it's the small wins. I think that's really, really important.
Yeah, definitely enjoyed all of our experiments, big and small. Yeah, I think having collaborators as well was that which is the joy of using a Trello board, is that you can invite people from within the team or externally to look and see what's going on, where there is a passion maybe, or where we're gaining more momentum, but also where things are slowing down. And that slowdown's really important, because you think, you know, we're enthusiastic at times. So actually sometimes that slow down and waiting and pausing to watch the ripples is really, it's hard, but
and just to answer a question over here, so I can see the question that's come in over here about, can you say a bit more about the team and who is involved? So who is involved was psychologists. So our team is a partnership. We're working with NHS. So the way this team is set up is a partnership with Second Step and NHS, and having the psychologists on board was really important. But also, most importantly, is obviously having the clients involved. And I think hearing their voices in terms of how it was structured, getting that feedback, because initially the idea was with the psychologist, worked on it, spoke with Lisa and the other colleagues within the team. But it was also important to get the voice of our clients with lived experience to actually comment on whether these questions were really sort of helpful or not. And yeah, and what kind of change does this lead to? I think really, for me, I guess for me, the biggest change that it's led to is that the idea is that this is going to be used across AWP and hopefully nationally, the personalized equality impact assessments across all sectors. And a big change as well was around health professionals looking at individuals' needs, especially around sort of stuff like culture, whether it's race, religion, all these kind of things, and not just looking at the clinical element. Obviously, the clinical element has the space, but what's really important is having those understandings of where they're from and the upbringing and the impact that has on their mental health and the service that we provide as well. Got another question here, Lisa. Do you want to go ahead and answer it? Because I don't want to just...
Can give it a go.
Yeah.
So if possible, are you able to share an example in practice where you've embedded some ideas? Well, as Temba mentioned there, we've got the personalised
equality impact assessment.
Thank you. I always struggle with that one. Personalised inequality impact assessment. And this is a completely new way of working in our MDT team, and in fact for the hospital that we are partnered with. And it was taking the idea of equality impact assessments and completely turn them on the head and say, from a client perspective, how is this working? How is this working for me today? And just that complete flip sounds obvious, but for the hospital itself, they really embraced it once they got behind the idea. And that's now been embedded, I believe, in the whole service.
Yeah. So that's it. That is the idea. It's around, and I think a key thing around it, and I think it was one of the first questions, again, who is involved? And I think connecting back to the conditions for change, I think a lot of teamwork, and teamwork is just a word that's thrown around a lot, isn't it? But working, I guess, collaborating with different agencies and partners is really important, because having the psychologist on board was really important, from the NHS side of things, to look at it and see certain things that were appropriate to ask as well. And again, as I said, lived experience is really important as well. And having all those different parties to actually create this assessment, help create this assessment, was really important. And, we hope that across, I think nationally, it should be everywhere. And it's constantly developing. It's constantly developing. You'll work in different teams. The templates there are willing to share the template that we have together. There's some guidance as well with it, and it will be tailored obviously to the type of services. But the main thing is that it brings out those core things of individuals, in sense of, as I said, understanding the complexities around the inequalities that they face, and just really getting to know who they are, rather than just doing a generic sort of equality impact assessment.
It's all about bringing the client back into the centre where they should be, and refocusing everyone back on being person-centred. I think it's so easy to forget, and we all try hard to be person-centred, but systems are systems, and they sometimes do pull us in the wrong direction, and the client can get marginalised. So that's why this was really important to Temba, to see that this was addressed and that the client was firmly in the centre. So, got any more questions?
Yeah, please fire away. I'm conscious of time. So what was it? We're here to what, 25 till 25
we're all right.
past, isn't it?
We left time to do some other questions at the end as well, if people think of anything else that they want to. You said, Temba, that the you said about the personalised inequality impact assessment template. You said that's something that you can share.
Yes, most definitely. I don't know if I would. Yeah.
So if any of the attendees today wanted to see it, that's something you'd be happy to share with them, is it? Okay, well, in that case, so if anybody would like it, to contact me, and I'll get it over to anybody who wants it. So that's great. One more question. What was your main learning from this experience for the two of you?
Oh, I'd definitely say mine is curiosity. You know, you never ever stop being curious and keep asking questions. The more that you ask, the more you learn. So that was my main learning. Never stop asking questions.
I guess mine was the importance of being reflective and reflecting on the work that we do. And I said this already earlier on, that it was just how at least yourself and, you know, having other colleagues around having those spaces to just pause and just actually think about what's happening and what change we're actually doing, and sort of picking out any gaps that we kind of missed as well. So yeah, for me, it's reflection. Reflecting is really important.
Okay, thank you both very much. And if anybody has any more questions for Lisa and Temba, just pop them in the chat and we've got time for them at the end. So now we will hand over to Dom, who's going to give us a strategic view on what enabled him to make system change and how he's seen others make it, with a focus on empowering and encouraging people. So Dom, over to you.
Thank you. So I'm Dom Wood. I'm the Chief Executive of 1625 Independent People, which is a youth homelessness and care leavers organisation. And also I'm on the partnership board for Golden Key. And yes, I'm here to talk about what's enabled me and others to make change, but I just think it's important to reflect. There are some words around the conditions that both Temba and Lisa have used that I'll be using. So it's really important to hear the words support, relationships, humility and passion for me, and I think they're all really important in conditions. But first, let's think about systems, because I think it's important to understand the different types of systems that there are out there. And so I would say simple, complicated and complex. And the way I remember them is simple is simple. Complicated, I like to think about a rocket. It's complicated, but it's ruled by some form of order, and there's a manual. And if something goes wrong, you can look up what to replace or what to mend, and it may be that the rocket will work again. And bear with me, for complicated, I like to think of the reintroduction of wolves into Yellowstone Park. So what was being done there was introducing a predator into a park of mainly prey. So thinking about what would happen there, and I'm sure lots of you know this, but the wolves kept the elk on the move. The elk on the move meant that the willows became more robust as it wasn't being as intensively eaten. There was therefore more food for beavers. The beavers made more dams. The dams made more habitats for fish and birds. Elk died at different times in the year, so there was an equitable distribution of elk to be eaten by ravens, eagles, magpies, coyotes and bears. And so what the effect was of introducing a predator into this environment was that there was a wider diversity and more prey, in fact, and you know, not a change that necessarily could have been predicted. I use those examples because they're abstract and they don't confuse me when I'm thinking about approaching a system that I'm involved in. But complexity means to me that I don't know the answer. And as a chief executive, that's not something that you often want to admit to. And that takes some of the humility of you don't know what the answer is. Others don't know, but they probably have a better idea because they're closer to it and can work out what might be worth trying. And I was brought up in a science background, so historically I knew there was more and more data that I could find, and you could get more complex systems finding data, and surely if you did that you'd get the answer in the end, and that was the way to go. So why am I here talking today, and where do I come in? I chaired the Golden Key System Change Group for a couple of years, and there were some changes made. And in my role outside Golden Key, I'm also responsible for some changes, both inside the organisation and outside. And I'm going to use some examples, but in any example, many people will argue how these changes happened, why they happened. But I know that they were pushed at my level and with those around me, and that those ripples go out, and there are different levers that mean that change might happen. And it's really important to recognise where you need to influence. And if you wanted to know more about that, you could read some stuff by Donella Meadows that talks about the levers for system change, because it's important to understand where you're trying to make the change and who might make that change, or what might make that change for you. So a few examples of changes that were made. The government proposed to take housing benefit or housing entitlement away from 16 and 17-year-olds. And that was massive, big thing at the time, particularly for us, because that's the field that we work in. They planned to remove the right, then they stopped, and then they told everyone that it was their idea to take away that because it wouldn't have been fair. There were lots of things going on in the background. The commissioning of the adult homeless pathways in Bristol, it wasn't a full competitive tendering, and that was definitely discussed and pushed at the Golden Key system change level, and then discussed at Partnership Board in other areas. Improving information sharing between secondary mental health services and housing providers, a more consistent cross-sector approach to risk assessment for those with arson convictions, which is a big block in complex needs. And commissioning documents written with an expectation of joint working between drug and alcohol and mental health services to try and work on the block that we've heard for many years, unfortunately, about dual diagnosis. So some of these were at a low cross-organisational level, some at a local authority level, and one at a government level. None of these on the face of it are as complex as wolves going into Yellowstone Park, but there are complexities in all of those systems. And often thinking about people's drivers, the other people involved and the people that you think are causing the blockage, if you know their drivers, it's easier to influence change because you can negotiate a way through that. And often that bit's neglected. So how did this change happen? What enabled them? The government one, although outside of the Golden Key System Change Group, was something that people were involved in at the time. But I will concentrate on the Golden Key System Change Group examples and what was there that allowed that to happen. So the System Change Group and the Partnership Board had a group of individuals who were all trained in systems thinking, who wanted to make a change. And that's important. For them, it was the right thing to do to make a change because the system wasn't good enough. And so what I would say was the understanding, both of what some of the blocks were, but about systems thinking, and the passion, which both Temba and Lisa talked about, the passion to actually make a difference. They brought an organisational knowledge of blocks in the system for people with complex needs, and there was a whole long list of them, as you can imagine. And importantly, at one point through the process, there came dedicated support from something called the Spark team. And for me, this made a real difference. So again, support was something that Temba and Lisa talks about a lot. It's really easy to go to a multi-agency meeting and have passion, isn't it? I'm sure you've all been at them. And what happens is, how many times have you been to them and loads of people take on tasks and you go back the next month and no one's done their tasks? And you go through this really painful bit at the beginning about the actions from the last meeting. And actually, half the time, they can't even remember what the task is. And you spend 5 minutes talking about what does that action mean. That's always going to happen. We have our own jobs and we leave meetings, and then there's lots of other things going on. When I leave this webinar, there'll be things that need my immediate attention that aren't the things that I thought I was going to do. And pre the Spark team, it was really difficult at times to chair that meeting because it was really similar to that. And you didn't know what energy you walk into in that room from month to month. What the difference made was a little reminder between meetings that you had an action, a little chase for information about how are you getting on, and then an ask of what support was needed and an offer to look at that support. And all of that smooths the wheels of you being in a multi-agency system and being the person who decided it was important enough to take on that change. But there were also things we had to get rid of, and they took quite a bit of conversation because they're things that naturally happened. So with a long list of blocks and barriers, they're all really important, aren't they? And we can think of things that are really important. But if no one's got the energy to take it on, it's not important enough. And that's okay. It stays on the long list. We know it's a block. But at the moment, no one's got the energy to take it forward. We capitalise on what people do have the energy to take forward. And that's really hard to do as an organisation and as a group of professionals who really care about the outcomes. How can you sit there and not take something forward? But you can't do everything. And then one we talked about a lot was the embarrassment. So that bit I've said where you turn up at a meeting and you haven't done your actions and you don't really want to talk about it because you know everyone was looking to you to do this. And actually, maybe you just won't turn up to the meeting because it's embarrassing to say that you haven't done it. And then if that's gone on for 2 months, that. So we talked about that and we agreed there is no embarrassment. If it hasn't been taken on and it hasn't moved, and that's okay, what do you need from us as a group to help make that happen? Is there somebody else who can help do that at the moment? You're not on your own. And if we can't do it, let's move it back to the list of things that we can't work on at the moment because they just haven't hit the threshold of being important enough. So the necessary factors, I would argue, well, it is arguable, but I would say the training or understanding of what systems are like, about the levers, about nudging people and who we can influence. And actually, if we can't influence it at all, because sometimes that's important to know. The energy and a wish to make a difference. Not everyone's got that energy in their job. And even those that do have it, they haven't got it all of the time because there are other things going on. But the relationships where there's mutual trust and respect and an understanding of the drivers and the issues that affect other people in their roles. So people don't want to make blocks. There are other things that cause issues. And then lastly, the support. And we were lucky in having dedicated people and keeping that change happening, the prompts, the reminders, the support. Just that person who's there. Hey Dom, how's it going? How are you getting on with that? So breaking down barriers in the system, I will say, and I keep saying the same words, relies on good relationships and a common goal. And you often get those things together by spending time together. And I wonder whether that will happen in the way that we work in a hybrid world. And that's a challenge for us, I think. How do you get those relationships? How do you get that passion? How do you get that understanding of your joint inspiration? Because quite often that isn't the conversation that happens in the meeting. It's the conversation as you make a cup of coffee or you're walking to, your bike or your car or wherever you're going. So the question that we need to think about is what holds everyone together in future systems that we need to work on. So if I look back over the last couple of years, the pandemic brought a common goal. And that meant that lots of things changed, and they changed quite rapidly. Everyone had the same things to work to. And we're moving out of that, and we're moving back to partnership boards. Now, I say it in that way. Some of them are probably exciting. Think about the boards that you sit on, or the joint multi-agency meetings you sit on, and think about which ones are really working. I think what it needs is strong relationships. So are the relationships strong enough? Is there the energy in that room or in that meeting? Do people understand system change? Can a common goal or barrier be agreed? And is the support there? And are people willing to adapt their own ways of working? Now, I can think of meetings I go to at the moment where Zoom meetings, quite honestly, I think other people aren't listening and they're just doing other work at the moment. So I'm not sure that that's going to get the passion and the energy to make some of the changes. And I think we really need to be aware of that as we move forward. So I'm just going to go back to a current example for me. And I'm sorry if anyone's involved in this in the room, because I just want to use it as an example of my working life and things that sometimes gets a frustration. And I think it's the scientific approach. But I work in the field of children and families and how that crosses over with housing. And often in prevention and early interventions, and now recently in some transitions work, the idea of system change comes up because, quite frankly, there is an issue with the way that we work with 16 to 21-year-olds, and they cross a threshold between children and adults. And I know I've got a couple of minutes. Des Holmes, who's amazing, look her up, Des Holmes. She talks on research, she's on research and practice and talks about changing systems for people in transitions. If you listen to her talk, you will have energy. She came and talked to the Children and Families Conference pre-pandemic, and everybody in that room wanted to change the way that we work with young people on the edge of care in transition. And I've seen this lots of times, but I was really excited. Everybody there, from the director of people downwards, was ready for this change and just excited about it. So there was a transitions multi-agency group set up, and there was loads of passion. We identified a cohort of young people on the edge of care. We wanted to change the way to work with them, to see what would happen, and especially around the way that they move in mental health thresholds between children and adults, and the skills in children's social work and adult social work, which are really different, and all those interconnected systems. And then it got delayed by COVID, and then it restarted, but people had moved on and it was different relationships. And then you just about get people to buy into the idea again, and you've got a small identified cohort and you're going to try something different. And then the next meeting, someone pipes up and says, well, what about this group of people? And what about this group of people? And we can't do it at this age group without doing it at this age group. And suddenly we're talking about everybody who is in any transition across the whole system. And you're not going to get system change then. And it's not moving. And this is what I've seen year on year on year when I've seen this come up. So I don't know what's going to happen with that. I actually wanted to be chair of the group before that last meeting. So we'll see what happens. But what it needs is relationships, energy, understanding, a common goal, support. And again, I'm not clear how that's going to work in the world of Zoom. If you want to see more on conditions of system change, Golden Key have got an excellent legacy kind of poster of all the things that need to be there, which has a load more things than I've said. But I guess that's me for now, and that's what I think about what needs to be there and what sometimes goes wrong. So thank you.
Thanks, Dom. So really, what I got from the end of what you said there was that you mustn't try and change everything. That if you try and change a small thing, then that will have ripple effects. But if you try and if you think too big and want to change everything, then nothing actually happens. That's
yes,
yeah,
yes.
That's
and then, are you actually really going to change it? Is the appetite there?
Yeah.
It's really important.
Brilliant, thank you. We've got a couple of questions that have come in as you were talking. So one of them, we know services are under a lot of pressure at the moment, underfunded, understaffed. How do we balance this with creating enough capacity for staff to experiment and create change? So I don't know if anybody wants to jump in and respond to that. Lisa?
Yeah. Yeah, I mean, there's nothing new there, is there? There's never enough money. For us, I think it was about trust that your team, they need the time to be creative, and it's an investment in your team. So you trust that the people that are in your team are going to come up with the new ideas, and actually it's value for money to let people have that space and time. You'd be amazed at what comes out. I mean, this is just one example that Pia's what Temba done, but we've done loads of great experiments. And like I say, not everything is about creating a system change. Some of it has been learning, and that learning in itself has had huge value for the team. So I think you've got to just say it's essential, and just sorry, has to be done. And yeah, finding space, with reflective practice, that's proven time and time again how important it is and how valuable it is to services. And I think it's on par with that.
And I think I'd say, of course, there's pressure on services. And it depends what change you want to make. So sometimes the change can be small that makes things more simple. And I'm not going to have the answer to that in a team. The people in those teams will have that answer. And sometimes just allowing people the freedom to make some of those choices themselves allows that change to happen. And having a culture of talking about change. But also it's worth thinking, what else could you do? I mean, a lot of what we do as an organisation is outside of the statutory funding stuff. And actually, if you look in the market of fundraising and trust, there are a lot of trusts out there who particularly want to see what system change you're creating. And that's the basis of why they're going to fund you. So if you know what you want to do, and you've got the energy, and you've got the relationships, and you've got everything else, then maybe think outside the box of that service, and how will you make that change as an organisation, and what is it? Where will you get that investment from? Because there are people out there who invest in that.
Thanks, Dom. Another question, which I suppose you've covered a little bit, in what you just said, how important is it to have management buy-in and support to create change? Can operational staff create change without buy-in from the people higher on up? And how would you convince your manager that it's beneficial? We'd like
I
to.
think I'll go ahead. Yeah, I'll go ahead and answer that. Because Lisa will know this very well, because Lisa is actually my line manager. And I think it really helps around relationships. I keep mentioning this because I think relationships are very, very important. And I think it's about understanding that this system change is not just about, it's not just theory, it's about actually improving our services. So I think the most important thing is around having those relationships with your manager, a trusting relationship where you can have these conversations, say, this is actually going to make us do better as a team. So I think that's really key as well. And I think also having the communication of what you actually want to achieve. And back to what Dom said, I think what's really important is that it's the small things that count. I think sometimes we look at the big things and we want to change the world, which is going to take a very long time, because I'm sure many people have been trying to do that. But those small things count. And having that relationship with your manager is really important for them to understand that this small change is going to help the team and help them as well, because I think that's really important. But yeah, the biggest thing for me in convincing manager, it wasn't hard, because as I said, Lisa's also system change champion. But moving forward, I think it's about showing that this actually works and we all have the same goal, singing from the same hymn sheet. We all are doing in some way, in some shape or form. It's just how that looks.
And I do have a chair of board, so technically he's my manager, but I don't have a manager. But what I would say is, again, look at the drivers for people that you want to change and look at where the lever is that you can influence. So to give an example, it's not a manager, but I talk to a commissioner. I get really frustrated sometimes in commissioning processes and the way that they're done. But then I talk to a commissioner about what the pressures were on them and how that worked. And then you look at a way to fit both people's needs. So it would be the same with the manager. If you know what the drivers are and what the pressures are on them, then that's a way of approaching it. Or you look at where the lever is somewhere else. That means that you can influence that change. And I'm obviously not telling anyone to go away from their manager to influence their manager from the side, but there are ways of looking at where is the appetite for doing things differently and how can you manage that. And I know that people I manage do that sometimes. They will look for where the appetite is for a particular change and go in that area to make sure that it's done.
And I think I just want to chip in there to say it really is important to have that support. I mean, for myself, obviously I have a line manager who are massively supportive in taking a massive chance and a massive gamble on me coming in and going, do you know what, we're going to do it like this. And we're like, okay, and then we're probably sweating buckets in the corner somewhere, but I really appreciate that they trusted me and trusted that this was something that we could do. But thinking about before I really got into system change, it was something that I was kind of doing but didn't know it had a label. And I can really remember previous managers in another role trying to do the square peg round hole, and it was frustrating. And one of the things that I can remember doing was adopting an approach of having an evidence folder. So every time I done something that I thought was a success that was maybe outside of what was my normal role, I'd pop it in a folder. And when we talk about doing things differently, like I say, at that point, I didn't know, I hadn't had the training on system change. I just knew that I had this urge to try and experiment. And I'd bring them out and say, well, look, you didn't agree with this, but actually, I went and researched. I got some collaborators outside of the organisation to send me some information. And if we tried it this way, this is what you can achieve. And I think that's one of the key things that I was learning was to, sometimes you got to be a bit brave and actually step outside your comfort zone, and get evidence, to help people come on board and use that as your influence, or use outside sources to help influence, to change that person's perspective. But like I say, in this role as a system change champion, I did have really supportive higher management, so not so bad in this one.
Just going to add really quickly, I think that what you said, Elise, is so important about being brave, just the courageous is part of our second step values. And I think you just need to do it. And maybe sometimes a manager might complain, and I know this might sound controversial, but my idea is if it's going to improve the service, then why not? And if you don't get the support and whatever, there are other people within different partnerships who are willing to support. So it's just about go ahead and do it if you believe in that change.
Great, thank you. One final question's come in. Is partnership work essential to system change? If you'd like to.
So I'm happy to start on that. I think one of the things that's important to know is that that quite often in Golden Key we talk about action experiment as a way to do system change, and that's what's being described quite a lot by trying and seeing what's happening. But there are lots of other ways to change systems, and you can do it individually, and you can, and I'll give some examples. I mean, it first of all, it depends what you want to change. If you want to change a complex system with lots of interdependencies and relationships, then you're going to need to know or be able to see what happens when you do it. If you want to change something by threatening somebody with a very good legal case, then you can do it that way. So there are real examples in. So let's talk about how under 18s are treated in the homelessness sector. That was changed by lots of evidence and one person supporting one legal case to happen, and it changed the whole system. There wasn't necessarily partnership working involved in that, but that isn't the model of doing an action experiment and seeing what's happening. So I guess it depends on what you want to change, who you want to change, and what your preferred style is in doing that. But to do that, you need to recognise whether the system is complicated, complex, or simple, I think.
I think for me that actually it's the word partnership. It's experiments should be collaborative. So I think a partnership depends how you view it. If it's an internal system within your own organisation, you may not need partnerships, but you start working at a local and national level, as Dom's mentioning there. Your partners are really important. It's your network of influence. So you are always going to need some sort of partnership, whether that's formal or informal. But these things work through collaboration. So that's where you get your best level of success through change, is through that involvement of other people.
I think when I talked about the ripples that can be affected. So one of the examples was about changing commissioning practice, and that got discussed individually by me. It got discussed at System Change Group, it got discussed at Partnership Board, it got discussed in other fora. And through that, you have an effect that probably wouldn't have been there if it had just been a single voice at the beginning. But it was a single voice at the beginning, and then that creates that whole effect.
Yeah, I think for me personally, I think, yes, I think partnerships are essential, because I guess, but again, I guess it's the behaviors and attitudes as to how you approach those partnerships. And I think I kind of mentioned it earlier, and I think Dom has touched upon around the humility. So I look at partnerships as like relationships, whether it's your wife, whether it's your husband, whoever it is, or your partner, fiance, whoever it is, there has to be a level of humility, a level of reflection as well. And also realizing that we all have blind spots as well. So we, just understanding and listening to the partners is really important, and being clear with the communication. I think that's probably really important, because sometimes with partnerships, people maybe we want the same goal, but then it's just how the approach, how we're all going to sort of arrive to that destination. And I think it's really important around being clear on the communication. And as I was going to say as well, I think what's essential as well is around the vulnerability. I think there needs to be an element of vulnerability around saying that, yes, we don't know the answers to all of this, or what do you know, and sharing that. And I think that does help, and that just shows the, you know, the significance of partnerships for system change. Really is important.
Thanks, Temba. I think that's an excellent point. To be able to say, I don't know, I think is a very, very important thing. And I think it engenders trust in other people as well. If you're honest and say, I actually need your help on this one, then cooperation moves on very well from there. Brilliant. So that's perfect timing. I'd like to thank you all. That was really interesting. I hope everybody found it as interesting as I did. We've run out of time, so I'd like to thank Lisa, Temba and Dom for their contributions. The next webinar we have coming up isn't next week, but it's the week after, on Thursday, the 8th of June, Creating Change, Perspectives from Our Evaluators. And this one is when Golden Key's independent evaluator, the University of the West of England, UE, will share their learning with us from the 8 years that they've been following Golden Key. So this webinar will join the others on our YouTube channel in the next few days. The others are already up there. So if you've missed the 2 previous ones, you can catch up with them, or if you want to watch this one again. And please feel free to share them with your colleagues. As soon as this one is up, I'll email everybody who was here today to let you know. You can also check out our website, goldenkeybristol.org.uk, where you can find and download all our learning products. So I think that's everything. And yeah, so thank you all for joining, and we'll end that here. Thanks, everybody. Bye-bye.